guys, this is Dr. AG and you are watching my YouTube channel Learn with Dr. AG. So I welcome to you all to our next lecture, that is about the joint flexibility, different kind of techniques to increase the joint flexibility like the stretches and its types, and also the PNF kind of techniques. So let's get into it. Joint flexibility, the relative ranges of motion allowed at a joint in different directions. So the amount of motions in different directions allowed at a joint is the quantitative measure of the joint flexibility. In other words, the range of motion that is allowed at a joint. So what is range of motion? The angle through which a joint moves from anatomical position to the extreme limit of segment motion in a particular direction into a specific direction, where we have to start from the anatomical position. Let it be the anatomical position of the shoulder is close approximate to the body, and from here if we want to measure the shoulder flexion, so we will move it like this way up to the extreme of that motion or the end range of that motion. So from the end range to the anatomical position, so we have to measure this range, that will be known as the range of motion of the shoulder flexion. So the range of motion is the quantitative measure of the joint flexibility. Types of flexibilities, there are two types of flexibilities. Number one is the static flexibility. In other words, that is the passive range of motion. Other one is the static flexibility or the active range of motion. So in the passive range of motion, the physiotherapist perform the full range of motion by himself. The active muscle activity is not involved. In the dynamic flexibility, the patient himself perform actively the range of motion, and the muscles of the patient work in this process. The joint flexibility is specific to every joint. It means that every joint has a different amount of flexibility depending upon the structures crossing it and also the kind of activities it has to perform. So the static flexibility is considered to be better indicator of the relative tightness or laxity of a joint. There are two kind of flexibilities: dynamic flexibility and static flexibility. So it states that the static flexibility is better understood than the dynamic flexibility. So dynamic flexibility should be sufficient to allow the range of motion for the activities of daily living, work, or the sport activities. Like, it means that the more significant would be the static flexibility. So here is the measurement of the joint flexibility of the hip joint. From here, that is the anatomical position, and the hip is taken into the full extension flexion, and the angle covered from the normal position to from the anatomical position to the end limit is the range of motion of the hip joint. So how can we measure the joint range of motion? We can use the different kind of tools like the goniometer, electrogoniometer, or the Lincoln flexometer. So these are the three devices which we can use to measure the joint range of motion. Normally we measure the joint range of motion manually by comparing to the normal, but if we talk about the literature, we have to measure document the things by using one of these three instruments. Normally the goniometer is used. The factors influencing the joint flexibility. What are the factors which influence the joint flexibility? It is basically relative laxity and extensibility of the collagenous tissues and the muscles crossing it. As already told you, the different kind of soft tissues that across a joint in the muscles, shape of the articulating bones. Like if we talk about the shoulder joint, elbow joint, or the hip joint, there is different level of flexibility in these joints because of their level of activity and the arrangement of the bones over there. Muscles and soft tissue. Example of the elbow extension and flexion. If we talk about the elbow extension, so end range is limited by the approximation of the two bones, the radius and the ulna and humerus approximation at the olecranon process, and the elbow flexion is limited by the muscles belly of the bicep in front of it. So tight ligaments and muscles are the most common inhibitors of the joint range of motion. In normal, there are different factors which limit the joint flexibility, but in the pathological way, the tight muscles and ligaments play the major role to decrease the range of motion. Lab studies have shown the extensibility of the collagenous tissues increasing slightly with the temperature elevation. As the temperature increases, there is a relaxation process in the ligaments or the muscles. So as a result, the flexibility of the structures is increased. A risk of injury is heightened when joint flexibility is extremely low, extremely high, or significantly imbalanced between the dominant and the non-dominant sides of the body. When there is high flexibility or low flexibility, both extremes are bad. The only good thing is the moderate or the middle range of flexibility, because if there is increased flexibility, that will cause the instability of the structure. If there is low flexibility, that means the structures are tight and there is chances of tear of that structures. The desirable amount of joint flexibility is largely dependent on the activities in which an individual wishes to engage. Depending upon the amount of activity, what you kind of activity you perform. Let it be the example of a gymnast or the dancer. They have to perform those activities which require more flexibility, so their body would be more flexible. And let's compare it to with a weightlifter. So weightlifter need more strength or power comparing to the flexibility, so there would be low flexibility in the body of a weightlifter as compared to the gymnast. Athletes and recreational runners commonly stretch before engaging in activity for the purpose of reducing the likelihood of injury. Before performing any kind of physical activity or the sports, we do the warm up. So that warm up is for the stretches of the soft tissues, so that the flexibility would be increased. Like this one, gymnast, there is a high flexibility of the body. Effects of age on the flexibility. Normally it is considered that over the growing age, the flexibility is decreased. The reason is, with the increase of age, there is a chances of low activity and low extreme range of motion. So if there is a low activity and low stretches of the body, there are chances of decrease of the flexibility. So regardless of the aging effects of the individual, however, life, if the collagenous tissues crossing a joint are not stretched, they will shorten. So we already said that because of the age factor. But if a person who is not physically active and he's young, in a younger age, because of the shortening of the collagenous tissues, there are chances of decreased flexibility. And a person who is older but has increased physical activity and he flexes his body on daily basis, he would have a greater flexibility. Flexibility can be significantly increased among the elderly individuals who participate in programs of regular stretching and exercise, as I already told you. So what are techniques by which we can increase the joint flexibility? Number one is the neuromuscular response to stretch. There are Golgi tendon organs, that are the GTO or the muscle spindles, which responded, active or passive stretches, ballistic or static stretches, and the lastly is the PNF techniques. These are the different ways by which we can increase the joint range of motion or the flexibility. So neuromuscular response to stretch, what does the Golgi tendon organs? There are 10 to 15 muscle fibers are connected with a GTO. Golgi tendon organ is a, you can say, a receptor for the tension in the muscle. GTO are stimulated by the tension at a muscle tendon unit, the musculotendinous unit. The inhibit tension in a muscle and initiate tension development in the antagonist. Let it be the bicep muscle that is being stretched or is working more efficiently, and it is contracting strongly. As a result, the GTO will be triggered, stimulated, and it will inhibit the agonist and contract the antagonist. As a result, the relaxation of the bicep will occur. Both the muscle contraction and the passive stretches stimulates the GTO. If I contract this muscle strongly, it will activate the GTO, or I will stretch this muscle, it will also activate the GTO. So the threshold for the passive stretching is much higher. We have to stretches to extreme level to passively to activate the GTO passively. So in this picture you are being shown, this one is the tendon, this is the muscle belly. So this is the musculotendinous junction where the tendon and the muscle belly is being connected, and here is supplied by the Golgi tendon organ or the GTO, and here is the sensory nerve fibers going out of it. So this is the schematic presentation of the Golgi tendon organ present in the musculotendinous unit. Next is the muscle spindles. Provoke a reflex contraction in stretched muscles or inhibit tension in an antagonist. What does it mean? It causes the contraction of the stretched muscle. Let it be the bicep. If it is being stretched, it will cause the contraction of that muscle, and as a result the antagonist will be inhibited and the antagonist will relax. In the Golgi tendon organ, bicep was relaxed because of the increased tension and the antagonist was contracted. In the muscle spindles, the bicep, which is the agonist, that will contract reflexively and the antagonist will inhibit. So 3 to 10 muscle small fibers, that are the interfusal fibers, they are supplied by the muscle spindles by one muscle spindle. So interfusal fibers, there are two types of interfusal fibers: nuclear chain fibers and nuclear back fibers. Nuclear chain fibers, they respond to muscle lengthening, and also that is the static response. If I continuously statically lengthen the muscle, and it will cause the stretch of the muscle, it will stimulate the muscle chain fibers and contraction will occur. If the I dynamically or there is a rate of lengthening of the muscle and there is a dynamic response that is given by the nuclear back fibers. So if I move the muscle by in a fast manner, so it will stimulate the nuclear back fibers, but if I sustain a stretch, it will stimulate the nuclear chain fibers. I hope you understand this. So the dynamic response is stronger than the static. It means that if I the rate of lengthening of the muscle is more responsive, like the nuclear bag fibers are more responsive as compared to the nuclear chain fibers. Muscles spindle respond in two ways. Number one is the stretch reflex and the reciprocal inhibition. As I already told you, the stretch muscle will contract reflexively, and the opposite muscle, the antagonist, will inhibit reciprocally. So if I stretch bicep, it will contract, bicep will contract, and the tricep will inhibit. That is the reciprocal inhibition. So in this one is the muscle fiber. So in the muscle fiber there is muscle fibrils, and there are nerve endings which are coiling around these fibers, that are the muscle spindle. And this is getting all the information to the sensory nerves, to the spinal cord. So here is the difference between the muscle spindle or the Golgi tendon organ. Golgi tendon organ are present at the musculo-tendinous junctions, and the muscle spindles are present in the belly of the muscle. So I have already told you the stretch reflex, that is the myotactic reflex, and the reciprocal inhibition. Here's the schematic diagram of the stretch reflex. Let it be when the quadriceps tendon is stretched, the active and passive stretching. So what is active stretching? Produced by the active development of tension in the antagonist muscles. If I contract my tricep, and it will stretch my bicep actively, by the action of the tricep, bicep will stretch. So it is the active stretching. And the passive stretching produced by a force other than the tension in the antagonist muscle. Instead of contracting the tricep, either by the help of another person or the physiotherapist, the muscle can be stretched, or by any other means the muscle can be stretched without using the antagonistic muscle's power. So that is the passive stretch. So active stretch is done by the patient himself, and the passive stretch is done by some other ways. So like here is the athletes are performing the active stretching before going into the any kind of athletic activity. Next is the ballistic or static stretching. Ballistic stretches is a series of quick bouncing type stretches. Brisk fast stretching that is usually performed by the athlete before any kind of activity is the ballistic stretching. Ballistic stretching is you can say intense level of stretching as compared to the static stretching. Static stretching is maintaining a slow, controlled, sustained stretch over time, usually about 30 seconds. Usually the stretching is performed up to 30 seconds. According to researchers, if we stretch for more than 30 seconds, that would not be much beneficial. It can decrease the muscle strength. So comparing both of these, ballistic or static, the static stretching is more secured, so it is preferable. Static stretching has been shown to be effective to increase the joint flexibility. A single 30-second bout of static stretching has a noticeably detrimental effect on the muscle strength, with additional stretching further decreasing the strength. If we increase the stretches over 30 seconds, that will decrease the muscle strength, that will affect the muscle strength. So next is the PNF techniques. There are different total 6 kind of PNF techniques, but we consider here only 2 techniques of PNF which can help us to increase the joint flexibility. I will make another video consisting of the PNF techniques for different kind of musculoskeletal problems. So I will cover the whole detail over there, but here's just a description of the PNF techniques to increase the joint flexibility. So PNF is the proprioceptive neuromuscular facilitation. It is a group of stretching produced involving alternative contraction and relaxation of the muscles being stretched. So what we have to do, there are two techniques, like showing this one, the contract relax antagonist contract technique, in which, like we'll say, the tricep is the muscle which is spastic or is limiting the range of motion of the elbow flexion. What we do first, we let this one is the end range, we give the resistance to this muscle at the end range, then we do the relax and the gained range is obtained, and then the antagonist muscle is contracted, like the opposite muscle is contracted. So this is also known as the slow reversal hold relax. So each phase maintained for 5 to 10 seconds and repeated up to 4 times to get a better results. And the other one is the contract relax and hold relax. So first of all, I contract this muscle, which one is the spastic, like the tricep. I contract this muscle, I do the extension against the resistance, I hold this position, and then I increase the gained range, that is the contract relax hold relax techniques. So I hope you understand this technique, and I will make another complete series of lectures upon the PNF techniques and a separate video on Golgi tendon, organ and muscle spindle difference, because they are important topics. So still then, stay healthy, keep learning and keep moving. Thank you.